What's up, gang? Dr. Tim Newton here again with Inspire Movement PT. We're going to talk a little bit in this video about what exactly a disc herniation or a disc bulge is. We're going to talk about what that looks like clinically and kind of what you need to do about it if you've got it. The first thing I'll say that I think is good for a lot of people to hear is that about a third of all of us, if they just got an MRI, which would show a disc bulge, a third of us have it. And fortunately, there aren't a third of us walking around with searing nerve pain in our legs or our arms. So if you've been told that you have this, you can take a deep breath. It's not a death sentence. It's something that does happen with time with individuals, but it doesn't necessarily need to dictate your life to you. So be aware of that, but we're going to talk about it because it does matter. It's just not that once you have it, your life is doomed. But we do need to be aware of it if we do have them, because they probably do contribute to aches and pains that occur in the body. So let's talk about what we're dealing with here. I'm going to draw the spine from the side here. I'm just going to draw a couple of vertebrae here. If you ever had an x-ray, it kind of looks like this. An x-ray will show the bones of the spine. So this is we're looking at the low back here. There's a little bit of a backward curve in these vertebrae here. The neck, the cervical spine that is, will have a very similar curvature. It's just kind of backward here like this. So this would be the front of the body. This would be the back of the body. This is what it looks like on an x-ray of a healthy spine. You've got the sacrum here, L5, L4, L3, L2, L1. These are the lumbar vertebrae. Now, that's what it would look like on an x-ray. You wouldn't see any kind of disc or anything on that. But if you did get an MRI, that would see soft tissues as well. That's like muscle and disc and stuff like that. What you would see there is in between these bones, you would see these discs, okay? And this is what they should look like. They'll be a little bit different of a color. So we'll make them darker on here. But basically the spine should look like that if you're just taking a cross section like that. If you looked at it from above looking down, like on an MRI, you can see different views. So this view here is if you just kind of cut me this way and it looked at the vertebrae and the discs in between like that. If you did an MRI where you did a section like this, where you're looking top down or bottom up, however you want to look at that, the vertebra would look something like this. Okay, and then there would be a little opening in here. This is the bone of the vertebra, and then this opening here is actually the canal through which the spinal cord goes down, level by level by level. All right, and what you would see on an MRI in there is a little dark spot there, and that's where the spinal cord is. This dark spot is the spinal cord. So really, the spinal cord is kind of running right behind the spine. This is the front, this is the back. Front, back, okay? And that's basically what it looks like on these images if you've had the opportunity to look at those for yourself. Now, what happens? This is the body of the vertebra, so we know that right above and right below there is a disc kind of sitting here. All right, right there. Now, what does that disc look like? This is not drawn to scale, but basically, you've got two parts to it. People have used the analogy of a jelly donut. You've got some squishy material in here that kind of acts as a shock absorber, and then on the outside, you've got some fibers that just kind of run around like this, and they're more dense, they're stronger, and they kind of hold it together. So basically what you get is this sort of hockey puck sort of shape where you've got this ring of outer fibers that kind of hold everything together, and you've got this squishy material inside. This is where there's more moisture and hydration. As we get older, we lose a little bit of that, and that's why disc height shortens. That's why we get a little bit shorter as we age. And that's a normal change that happens. So what happens when a disc bulges? So we're going to bring out our little Scotty the skeleton here real quick. just to show you here, just to review, we're talking about the bones, these are the vertebrae, and we're talking about the discs in between, okay? And you can see the yellow, these are the nerves as they come out of the spine. And you might be able to see a little bit of yellow between these vertebrae as we go down. That's actually the spinal cord, okay? Now, what happens when we get a disc bulge? You can see that these nerves are coming out very, very close to where the backside of these discs are. And you probably have already guessed, what happens is the disc bulges backward into these nerves that are coming out, or maybe even the spinal cord within the spinal canal. Okay, so what that looks like here is these fibers, due to bad habits, bad genetics, bad luck, we do a lot of stooping and twisting. We put a lot of pressure on these fibers and they start tearing one by one. This is me tearing annular fibers of the disc. But then what happens is basically this kind of yields a little bit, and this starts to bulge out a little, and the fibers start looking like this, okay? So now this disc is not here, but it's actually starting to encroach on the space of the spinal cord here, and maybe the nerve where it's coming out of that opening. So that is what it is. So what you can get are pinched nerves. You can get low back pain. These are the changes that happen. They're called degenerative changes. That's a pretty damning expression. But what happens is these discs are bulging backward. They're starting to encroach on the free space that this nerve has, or the spinal cord has, and it just makes your movements more difficult. Meaning you just don't have as much wiggle room. Whereas you might have gotten away with stooping and slouching and doing all that in the past, you might not have that luck now. Or it might be arching. You might not be able to arch as easily. It just depends on the nature of the way that this is bulged out. So it can present in different ways in different individuals. The pain can move around. That's actually a hallmark. If it's a whack-a-mole sort of thing, where it's like here one day and then here on your buttock the other day and then down on your foot the other day, it's usually just some slight subtle shifting in the way this is pushing on the nerve. This nerve sends the message to all of those different areas, hip, foot, shin, and just depending on the way that this is being pushed on, that is what changes the symptoms. So if you are one of those people who is playing whack-a-mole with the pain, I would really think about some kind of nerve impingement somewhere as the potential cause of your issue. And especially if you've noticed a new weakness in some muscles or numbness or tingling, those are neurological signs. We definitely want to take those seriously. So that's pretty much it in a nutshell. That's what a herniated disc is, or a bulging disc. There are differences in semantics, but really the bottom line is that there's a change in the shape. It encroaches on the free nerve space. You start feeling pain, symptoms, maybe weakness and numbness and tingling. But it doesn't necessarily mean you need to have surgery. It doesn't necessarily mean that this is a serious, life-threatening issue, but it is something to be aware of. So now you're informed. Go forward, strengthen that core, loosen those vertebrae in those hips, and get your life back. Thank you for watching. Have an inspired day, everyone.